Hello everyone. I am myself Dr. Rajesh Gubba. I am the general medicine educator. In this session, I'll be discussing the quiz which I have posted on my Telegram channel, that is Medicine Made Easy by Dr. Rajesh Gubba, on 19th of May. So every day I am posting the quiz and subsequently I am sending the explanation as well. So join my Telegram channel for everyday quiz discussion. So as a part of this, first question is, which of the following motor neuron diseases involves only the upper motor neuron? So if you take this motor neuron diseases, we classify them into following. We classify the motor neuron diseases where there is only involvement of upper motor neuron, where there is involvement of lower motor neuron, and where there is involvement of both upper and as well as the lower motor neuron. So if you take the disease where there is only involvement of the upper motor neuron, that will be primary lateral sclerosis. And the condition where there is only lower motor neuron involvement includes spinomuscular atrophy. And the condition where there is involvement of both upper and as well as lower motor neuron, that will be amyotrophic lateral sclerosis. So the answer in this question is the primary lateral sclerosis. Whereas in case of the amyotrophic lateral sclerosis, it is both involvement of upper and as well as the lower motor neuron. Now, what are the other disorders where there is predominantly upper motor neuron involvement apart from primary lateral sclerosis? The other conditions include pseudobulbar palsy. Right here also there is involvement of only upper motor neuron, and another important disorder is familial spastic paraplegia. So these are the three conditions: primary lateral sclerosis, pseudobulbar palsy, and familial spastic paraplegia are the conditions where there is involvement of the upper motor neuron only. Whereas what exactly is the Tay-Sachs disease? So Tay-Sachs disease, it is due to the enzyme deficiency, and the enzyme which is being deficient in case of Tay-Sachs disease is hexosaminidase A is the enzyme which is being deficient, and because of the deficiency of this enzyme, there is accumulation of GM2 gangliosides. That is what is the abnormality that you will have in Tay-Sachs. And this particular Tay-Sachs, depending upon the age, we classify that into infantile form, juvenile form, and as well as the adult form. So these are the three forms of the Tay-Sachs. And another option in our question was the Kennedy's disease. What exactly is the Kennedy's disease? It is an inherited motor neuron disease which is commonly seen in males. And which particular motor neuron is being affected in case of the Kennedy's disease? That is, lower motor neuron is being affected. So Kennedy's disease, it is one of the group of disorders called as lower motor neuron disorder, right? So among the options, the one which has only upper motor neuron involvement is the primary lateral sclerosis. Now you see the next question. So second question, if you see, all of the following are motor neuron diseases involving predominantly lower motor neuron except. The options are multifocal motor neuropathy with conduction block, adult Tay-Sachs disease, Kennedy's disease, familial spastic paraplegia. So if you take the first three options, like you have the involvement of lower motor neuron, but whereas in case of familial spastic paraplegia, it is the involvement of only the upper motor neuron. Now let me tell you few points about the familial spastic paraplegia. So paraplegia, that means you have the spastic paresis of the lower limbs. Because it is spastic paresis of the lower limbs, how will be the gait in these individuals? There will be a progressive gait disorder, and they will have the stiffness within the lower limbs, and that is what is nothing but the spasticity. And this HSP, what is the other name for this? Hereditary spastic paraparesis or familial spastic paraplegia. And in these individuals, what exactly are the structures which are being defective? So it is mainly due to dysfunction of the long axons in the spinal cord. That is what is the defect in case of this hereditary spastic paraplegia. And it is predominantly upper motor neuron involvement. These patients, they will have the features similar to that of the cerebral palsy. And what will be that feature similar to that of cerebral palsy? That is spastic diplegia. And in these individuals, you need to give anti-spasticity medications that includes number one, baclofen, and another important drug is the tizanidine. So these are the two drugs which will reduce the spasticity in these patients with familial spastic paraplegia. Now, next question, if you see, amyotrophic lateral sclerosis can be diagnosed by all of the following except wasting of the muscles, exaggerated deep tendon reflexes, absent deep tendon reflexes, and then the bladder involvement. So amyotrophic lateral sclerosis is that where there is involvement of upper motor neuron and as well as the lower motor neuron as well. And this amyotrophic lateral sclerosis, this is the most common cause of the motor neuron disease. And in these patients, they'll have wasting of the muscles, that is because of either upper or lower motor neuron involvement. They have exaggerated deep tendon reflexes because of upper motor neuron involvement, and they have absent deep tendon reflexes, that is due to lower motor neuron involvement. But bladder involvement is usually uncommon in these patients with the amyotrophic lateral sclerosis. In motor neuron disease per se, you can have the bladder involvement, but in case of amyotrophic lateral sclerosis, which is a subtype of motor neuron disease, the bladder involvement is uncommon. And you should know the structures which are not involved in case of amyotrophic lateral sclerosis. So the vision, that is the ocular muscles are not affected, cognition is not being defective, sensory system is never involved in motor neuron disease or amyotrophic lateral sclerosis, bladder is not affected in amyotrophic lateral sclerosis, but in other forms of motor neuron disease you can have neurogenic bladder. Dementia, if you see, in a subset of cases, amyotrophic lateral sclerosis arise concurrently with frontotemporal dementia. So this is about your amyotrophic lateral sclerosis, and these are the structures which are not affected anytime in case of amyotrophic lateral sclerosis. And these patients, what are the drugs that you need to give is, you need to give the drugs which will slow the progression of the disease. Now, what are those drugs? That includes, number one, riluzole, and another very important drug is the edaravone. So these drugs, they will slow the progression or they'll stop the progression of the amyotrophic lateral sclerosis. And the next question is, all of the following are never involved structures in motor neuron disease except bladder involvement, nuclei of the cranial nerve, ocular muscles, cognition. So like the question asked is in motor neuron disease, never involved except, that means which of the following are not being involved in this motor neuron disease. So cognition, yes, it can be affected in motor neuron disease. Nuclei of the cranial nerve can be affected, and bladder involvement, yes, there can be bladder involvement that is in the form of neurogenic bladder. Okay, so there can be neurogenic bladder in these patients with motor neuron disease, but in ALS it is not involved, but in other subtypes there can be neurogenic bladder. But what about the ocular muscles? Ocular muscles remains intact in spite of the advanced disease. Ocular muscles are not affected in these patients with the motor neuron disease. So that is the reason why the vision will be normal in these patients with the motor neuron disease. Next, which of the following represents the site of lesion in motor neuron disease? Anterior horn cells, peripheral nerve, spinothalamic tract, spinocerebellar tract. Now in case of motor neuron disease, you have to understand that as the name tells you, there will be only motor manifestations, right? There is no sensory involvement in these patients with the motor neuron disease. So that is the reason why spinothalamic tract and spinocerebellar tract are not affected in patients with the motor neuron disease. Now, it is only the motor component which is being seen. So anterior horn cell is also a motor component, and in the peripheral nerve also you have the motor component. But between these two structures, the most common structure which is affected in motor neuron disease will be the anterior horn cell. And this anterior horn cell, it is a part of the lower motor neuron. And in case of amyotrophic lateral sclerosis and as well as spinomuscular atrophy, you have the involvement of the anterior horn cell. And because of the involvement of the anterior horn cell, what will be the clinical manifestations? And that will be in the form of the fasciculations, right? That will be in the form of fasciculations. So this is what you see in patients with the motor neuron disease. So the very, very important structure affected is anterior horn cell, and pathognomic feature due to anterior horn cell involvement will be the development of the fasciculations. So these are the questions which I have posted on 19th of May on my Telegram channel. So for daily quiz discussion, you can join my Telegram channel, that is Medicine Made Easy by Dr. Rajesh Gubba. Thank you very much. See you in the next session.